Have you ever wondered how effective trauma-sensitive yoga is for reducing symptoms of PTSD? Well, in research that was published this year, the question was asked, can trauma-sensitive yoga reduce symptoms of PTSD as effectively as a traditional therapy? Now, the comparison was trauma-sensitive yoga, to cognitive processing therapy. And the participants in the study were women veterans who had experienced military sexual trauma and received a PTSD diagnosis because of that history. Now, it's important to point out that this work concerns a very specific form of trauma-sensitive yoga, trauma-sensitive yoga. I'll sometimes refer to that as TCTSY. Now, researchers, psychologists, and yoga teachers at the Trauma Centre spent years experimentally validating, testing, and publishing their work. And if you're curious to find out more about that background, I'll link the Trauma Centre below. Now, there are other forms of trauma-sensitive yoga, and I'm not saying that they're not as effective or beneficial. It's just that they'll often use different methods. So they can be just different. So it's important to know there is a distinction. So a little bit of background, like why was this research done? So typically when a US veteran seeks treatment for military-associated PTSD, the Veterans Health Administration will prescribe two different psychotherapies, cognitive processing therapy or prolonged exposure. But the dropout rates for these types of psychotherapies are really high. Typically between 60 to 90% of people don't actually make it through the therapeutic program. And those that do make it through, often around half of them are still reaching diagnosis for PTSD. So firstly, why are the dropout rates so high? Well, it can be really hard to talk about a past trauma or the effects of that trauma, or traumas, and not to mention prolonged exposure therapy where someone's being exposed to their trauma triggers. And it's been reported that typically with these types of psychotherapies, symptoms of PTSD get worse before they get better. So there really is a need for other sorts of therapeutic options. So a bit about the methods for this study. There were 58 participants in the TCTSY group, and they received 10 weekly 60-minute group sessions. And TCTSY uses yoga forms to facilitate interoception, so a sense of the physical condition of the body, like a sense of what is going on in the body, and includes themes like taking effective action, choice making, and being in the present moment. So it's very much a body-based therapy. In the control group, in the cognitive processing therapy group, there were 46 participants, and they received 12 weekly 90-minute group sessions. And in these sessions, they focused on sort of more cognitive aspects, so how thoughts have changed because of trauma exposure, ways to evaluate maladaptive thoughts, and ways to create alternative thoughts. Now, PTSD symptoms were measured using two scales. For those interested, it was the CAPS-5 and the PCL-5 scale. And symptom severity was measured at 4 time points: prior to any therapeutic intervention, halfway through the therapies, and 2 weeks following the completion of therapy, and 3 months following the completion of therapy. And the results. Over time, both treatments reduced PTSD symptoms significantly and equally. On top of that, both groups had an equal reduction in PTSD diagnosis at the 3-month time point, with less than 20% in both groups still reaching criteria for PTSD. So these results show that over time, both treatments were as effective as each other. But there was one, that's an amazing finding. I'll just pause there before I move on to the next one. So to let that sink in, they're both as effective as each other. The other finding that really stood out for me was the retention rates. For the TCTSY group, attendance stabilized at around 60% after the second session. For the cognitive processing therapy group, attendance stabilized at around 40% halfway through. So this means a larger proportion of people finished the TCTSY treatment program. So let's put those two major findings together. The study shows that TCTSY is just as effective as cognitive processing therapy for reducing symptoms of PTSD, but because the dropout rates are lower in the TCTSY group, this means that more people finished the therapeutic program and more people found benefit, which is amazing. But there's some things to consider with this study. So firstly, this is an interim study. There is data coming in from other sites which will be added to these results, and I'm sure we'll hear more as that comes in. And this does concern a very specific population. So it's women veterans who had experienced military sexual trauma. And there will be a need for future research showing that these results hold for other sorts of trauma histories or other types of populations. But for now, this really is a landmark finding. Traditionally, it was thought that trauma-centered, trauma-sensitive yoga should be a adjunctive therapy or a complementary therapy, something that's done alongside psychotherapy. But these results are showing that trauma-sensitive yoga is a viable alternative in its own right. And I think this is amazing, especially with regards to trauma, because it offers choice for people with regards to their therapy. Some people might not gravitate towards psychotherapies, towards talk therapies. And this shows that body-based therapies, TCTSY, is an alternative. In the same vein, you might find people that don't gravitate towards body-based therapies and they might prefer talk therapies, and that's fine too. That option is there. Just knowing that both these different treatment modalities can reduce symptoms of PTSD is amazing. So I will link the paper below if you're interested in seeing that for yourself. There are a few other findings in there, but I just picked these two out. I think they were, for me, the major findings. And I do run TCTSY sessions. I run individual sessions and a 10-week group course. If you're curious in finding out more about that, I'll link my website below. But do feel free to comment or question. And thank you for taking the time to watch the video. And I hope you have a wonderful rest of your day. Bye for now.